health service providers can develop cultural competency in many ways. One of the first ways is about actually understanding the landscape of Indigenous people that you're serving. So understanding who's who in the communities, what kinds of Aboriginal communities you're serving, if it's a First Nation community, if it's a Métis community, if it's an urban Aboriginal community, if it's a rural community, if it's a remote or isolated community. It's very important to understand that. It's also important to understand which nation of people that you're serving, whether it's the folks are Cree, if they're OG Cree, if they're Anishinaabe, if they're Oneida, Haudenosaunee, Mohawk. It's really important to understand the nations of people that you're actually serving, and to understand that in urban communities there's going to be a diverse number of nations that you would probably be interfacing with. The next sort of basic information that you should have about Aboriginal communities that you're serving, Indigenous communities you're serving, is around the history of the Indigenous population, not just in your region, but in the country as a whole. And not just in Ontario, but in the country as a whole. You want to have a good understanding about the colonial history and its impacts on health and wellness and on community life for those communities that you're serving. And so when you have a broad general understanding about the history, about who's who in the area that you're serving, you can then begin a process of engagement with Aboriginal people to find out how they like to be engaged, to have discussions when decisions are being made about the care that's being provided for them, how you're going to do that together with them. So you want to look at appropriate engagement strategies, and there are ways to appropriately engage with Aboriginal people that you would need to learn. And those will look different depending on where you are in the province and who it is you're serving. So it's very important to go to ask those communities how they would like to be engaged before you set up your an engagement plan or strategy. It's also important in Ontario to understand that we have a lot of experience working with Aboriginal communities. There are a lot of examples of what works well that organizations can research and learn about. We also have in Ontario an Aboriginal health policy, which is critical because it does talk there about what representation means when you ask Aboriginal people to come to decision-making tables. It talks about equity. It talks about Aboriginal people's right to determination in health. And I think this is a key area around that's specific to Indigenous cultural competency as compared to other cultural competencies that you'd be interested in, for instance, like the multicultural communities or other minority groups. The key area around the Indigenous cultural competency relating to our right for determination in health is understanding that Aboriginal people are leaders in their health care, and that the healthcare system in Ontario can support and assist, but at the end of the day, Aboriginal people and Aboriginal communities have that right and maintain that right to plan healthcare for ourselves. And so when we're looking at collaboration and partnerships, it really should be with the understanding that Aboriginal people are always in the lead of that process, and finding out solutions, discovering solutions to address some of the long-standing health issues that we have in our communities.